Artificial Intelligence Doctor, www.abcpharma.net/English. User question: how to see in an ECG a decline in ejection fraction? Gemini AI answer: while an ECG cannot directly measure ejection fraction, it can provide indirect clues suggestive of a decline in ejection fraction, particularly when interpreted in the context of a patient's clinical presentation. Here are some ECG findings that may raise suspicion for reduced ejection fraction. Left ventricular hypertrophy, LVH. This indicates thickening of the heart muscle, often a compensatory response to decreased pump function. While not always associated with reduced ejection fraction, it warrants further investigation. Q waves. Pathological Q waves can signify prior myocardial infarction, which can lead to decreased ejection fraction. ST segment and T-wave changes. Nonspecific ST segment and T-wave abnormalities can sometimes be seen in patients with heart failure and reduced ejection fraction. Low-voltage QRS complexes. This may indicate diffuse myocardial disease or poor left ventricular function. Arrhythmias. Atrial fibrillation or other arrhythmias can worsen heart failure symptoms and potentially contribute to a decline in ejection fraction. Important considerations. Nonspecific findings. The ECG findings listed above are not specific for reduced ejection fraction and can also be seen in other conditions. Clinical correlation. It's crucial to interpret the ECG in conjunction with the patient's clinical presentation, symptoms, physical exam, medical history, and other diagnostic tests, e.g., echocardiogram, to assess ejection fraction accurately. Dynamic changes. Serial ECGs can be helpful in monitoring for changes that might indicate a decline in heart function, but again, imaging is needed for definitive assessment. In summary, while an ECG cannot directly measure ejection fraction, certain findings can suggest a potential decline. These findings warrant further investigation with imaging studies, particularly if a patient is experiencing symptoms suggestive of heart failure.